So my name is John Coughlin. I'm the Secretary General of the International Cerebral Palsy Society, and I'm the co-chair of the working group of the Civil Society Commission on WHO's Civil Society Engagement Strategy. And my fellow co-chair.
Hello, everyone. Good morning. My name is Dani Mozzi. I'm the CEO of the International Alliance of Patients Organizations, IAPO, and I'm the co-chair of the working group with John.
So for today's session, which we want to make as interactive as possible, a few housekeeping indications to start with. If you are online, you will see that this is a webinar format, which helps us to manage the access a little bit better. But maybe some of the features are not so familiar, so you won't see a chat. But what you do see is a Q&A section, and in that Q&A you will be able to see what everybody else is also asking their comments, so you can feel free to put in that. You can even comment on other people's comments, so it's basically like a chat. And you can also signal that you are particularly, you like a particular comment or a question with a thumbs up, and that will also help us in terms of the online, our online coordinator, as it were, to work out which are the issues that most people are interested in and want to bring to the discussion. If you are in the room, then please make sure that you have access to Wi-Fi. We had big problems with the Wi-Fi yesterday, but they have been resolved in principle. So this is important because this is a discussion where we want to involve both the people in the room and the people online, and the best way to do that is if you can get online yourselves and participate. You will see in a moment we'll have a few little polls and discussions. There is no mobile reception in here, so you really need the Wi-Fi. That's why I'm giving you time to get the code and make sure that you're connected. So to give you some background to the side event that we have here today, WHO engages with civil society already, but in a way that is perhaps not as transparent to everybody, as structured, or even as inclusive as we like. We have the framework for engagement with non-state actors and the principle of non-state actors in official relations with WHO, which provides a way for civil society input to be a part of the way that WHO works, but at the same time, that is actually restricted to a relatively small number of organizations that have a very intensive cooperation with WHO. So broader civil society doesn't have the same opportunity to engage. In 2023, the WHO established the Civil Society Commission as the first step in broadening that engagement with wider civil society. And the representatives of civil society that you will see that are animating today's side event, for example, we are members of the Civil Society Commission. Some of us are members of the steering committee, and that's where we're coming from. That's the background that we're coming from. If you're not a member of the Civil Society Commission, that's maybe something that you should look into and find out how to join. So if the Commission itself is the first step to broader engagement with civil society, then we're also being invited by WHO to contribute to its strategy on civil society engagement. And that's a discussion and a reflection that's been going on already for a couple of years since the Commission was established. Obviously, WHO went through a very big, challenging period over the last year, but we're back on track with this engagement strategy. And it's important to underline at the beginning, this is WHO's strategy. It's not civil society strategy. But WHO wants to develop that strategy in a co-design process with civil society. So while the Secretariat will be the penholder on the strategy, the idea is really that we contribute to it in a collaborative and as I say, co-design approach. We began within the Civil Society Commission the reflection on this work already a couple of years ago. There were 3 working groups that prepared this, and the outputs from those working groups are extremely useful and provide a very helpful foundation for us going forward. And Danny will speak about the content of those a little bit later. But just to explain, the 3 working groups were looking at existing civil society engagement mechanisms within WHO. Secondly, on thematic interactions, because we know that it's often in the context of our specialized interest in a particular topic that we engage, and that's where the great diversity in WHO's approaches appears, because one department will do it in one way and another will do it in a completely different way. And the third one was looking at lessons we could draw from other UN agencies and multilateral bodies on how they engage with civil society in order to inform the WHO's strategy, as it were, with examples of best practice. So that's where we're at, and as you will see, we're now moving forward on a relatively tight timeline. The idea is that we have a draft strategy for public consultation by September. So over the next few months, we're going to be in intensive consultation with WHO, and so that's where this discussion today is so important. Now, I warned you that we would have some interaction, so we're going to begin, and this is just a practice with the Mentimeter to see, to help us to get to know one another a little bit better. You have the code. I hope it's visible. Yes, it's visible. First question is very simple, but my computer is not. So just share with us which country you're from. This is the sort of thing you would normally put in the chat, so we'll put it here. We'll see where everybody's from. Canada seems to be particularly well represented. And the UK. But we also have people from as far afield as Brazil, Morocco, Kurdistan, India, Kenya. So just to check, is everybody able who wishes to, and you don't have to obviously participate in this, but everybody who wants to is able to participate here in the room. That's been the big test. And I hope everybody online is also managing to. Then further to get to know one another a little bit better, what is the thematic focus of your organization? And if you can try to keep it to just one word per answer, you can do multiple answers, but just one word in each answer. That will help us to, it will help the word cloud to configure more accurately. So health, no big surprise that should be the top result there, but we also see disability inclusion, hemophilia, aging, caregiving, NCDs, mental health. So quite a diverse range of different topics. Keep it going. It's great. So the big ones at the top: health, advocacy, social participation, inclusion, SRHR. Excellent, thank you. So we were hoping to have somebody from the Secretariat to explain their position. Unfortunately, it is difficult at the moment to get people because they're obviously so busy. The same people who are accompanying the Civil Society Commission are the ones who are doing all of the work with the non-state actors, making statements and participating in the sessions. So really, it's actually the worst possible week for us to get anybody of our usual counterparts along. So Ivana, I believe, is caught up. She can't come. Question is whether we can possibly call on Kaiser, who I believe is online, to jump in. I have to see whether we can do that. I'm gonna put him right on the spot. Kaiser, if you're able to speak, you should be able to do so now, but if not, we understand. You might be on the move. He's not responding. So I think, so Kaiser Pasha is our, the colleague who's really the real pen holder on this strategy, and he will be, he's working for EMRO, the Eastern Mediterranean Regional Office, and he's very active and very engaged. But I'm afraid that we're not going to be able to bring him in today. But this session is actually all about civil society's input to this strategy. So in a way, you can trust us when we say that the Secretariat is... we can hear you, yes. Are you able to speak?
My apologies, I have a bad connection, but I'll try to do my best. So without wasting any time, thank you so much for giving me this opportunity, and to the co-organizers and to yourself for making this happen. So why the CSO strategy? I think at the WHA, you must have heard these conversations that recent changes in global public health, especially the withdrawal of USAID from WHO and emerging declining trends of aid in development, that's one aspect. And secondly, the political landscape itself, from multilateralism to more countries looking inwardly, these affect both WHO and CSO in their common pursuit of improving health and well-being of populations across the world. As you would be aware, the UN as a whole and WHO have been undergoing a transition, and which is now being more structured into the UNAT initiative and tied to the reform of the global health architecture. In parallel, recent funding reductions, along with these political restrictions and the decreasing political space, shrinking civil space, pose a serious challenge for civil society organizations. From WHO's perspective, civil society organizations continue to be essential partners in the governance, design, and delivery of health services, including in crisis responses. Also, your voices and inclusion in shaping public health policy and priorities remain critical to ensuring the equity and accountability of all stakeholders, including governments, WHO, and other partners. Within this context, stronger WHO CSO collaboration is needed more than ever. The WHO Society Commission and the WHO Youth Council was specifically established to strengthen WHO's engagement with civil society and youth, ensuring that diverse voices contribute to global health efforts. So both have made substantive contributions over time, and I think you'll hear about these contributions over and over again at the WHA and through other events, and allowed us as partners to learn collective lessons. Now, moving on to this work that has been happening, the engagement with the CSO Commission, Youth Council, other technical areas in which WHO works at all levels, this was an opportune time to give further impetus to developing a WHO CSO engagement strategy, which will allow WHO to strategically position within the evolving context, build on what has been achieved for a more coordinated and structured engagement with civil society. Now, the second point you wanted to talk about was the scope. So, this is the secretariat led and co-created with civil society. That's the broader picture. This is a WHO engagement strategy with civil society, but it will be crafted, created with the help of civil society. As per terms of reference, the strategy is to provide a robust framework for enhancing collaboration, participation, and dialogue between WHO and civil society to deliver impact across our regional levels. While the Civil Society Commission, Youth Council have engaged very well at the headquarters or the top level at the regional and particularly country level real touch with reality, as if you may. The strategy will be aligned and operate within WHO's framework for engagement with non-state actors, which is called PENSA, engagement with NSA and including civil society. While there are some perceptions that there are some inhibitory things there, but I think in practice, PENSA is flexible enough to make this arrangement happen and this collaboration happen, and it's been happening. So one of the key things that is there in PENSA is that civil society isn't given a broader description. And also WHO and other entities use different definitions of civil society. So what we decided or what we are going for is that we define the constituents within civil society by exclusion rather than by inclusion. So, and the preference of the Civil Society Commission gave quite a good definition as consisting of civil society as consisting of non-governmental organizations, including, for example, grassroots community organizations, civil society groups, networks, faith-based organizations,
I'm afraid your sound is now breaking up, Kaiser.
and
We're
so
having
on and so forth.
difficulty in hearing you.
That we create. Sorry, can you hear me now?
That's much better, yes.
John, can you hear me?
Yes, much better.
Okay. So, okay. So within that, the strategy is WHO's. We are the pen holders. But then introduced, there's a dedicated working group of the Civil Society Commission, which will be involved in this, guide the process, the design process of the strategy, be involved in the consultations, and also review drafts as we move forward and advise on all the things that go into the strategy. So pretty much an inclusive process. And there are other working groups too, which are a regional and country engagement working group, a youth working group, which will feed into these processes, and other consultations, but like the one that you are having today, will also feed into this strategy. So final strategy will be approved by WHO as per its processes. On the timeline, John has already mentioned that we began this work somewhere in January, February, and we intend to have a first final draft for review and advanced draft by end September. So this is what we are heading. Analysts and the members who are attending to learn more, to be guided more, and to get your insights to feed into the strategy. And so once again, thank you so much, John. I appreciate and acknowledge the organizers and hope that the deliberations and recommendations will very positively inform the CSO engagement strategy. Thank you so much, John. Over to you.
Thank you, Kaiser. And you weren't scheduled to speak, so to jump in like that, really put on the spot, that's really very, it's a sign of your openness and your willingness to really to this co-design process. So thank you again. We have one question from a member of the online audience, which is, how will the consultations to develop the policy be organized at regional and country levels? What efforts will be expended to hear from grassroots CSOs, not necessarily the ones that usually benefit from ODA grants? I think that's quite a good bridge into Danny's presentation in the next section of this session, because we're going to talk about what we've already learned and what we need to do. And one of those questions is really, as Kaiser also emphasized, that this isn't just about civil society engagement at the global level, but also how that is translated at the regional and country levels as well. And also the whole question of definition of civil society is one of the issues we need to address. So over to you, Danny.
Thank you, John. I assume Kaiser touched on many of the points that I'm going to present here. It was a little bit difficult to understand, but I think it's very, very important to start with the following. There is already a framework on the engagement between the WHO and non-state actors, and this will continue to be there. So whatever strategy is going to be developed needs to be respected, need to respect what's on this document. Other thing is, as John highlighted a lot, what I'm going to present is the output of a lot of work from the previous working groups. And we have to take this into account because it's a very rich feedback. But also there are working groups in parallel working at the same time as the engagement strategy working group, the youth, the regional and country working group, and one on financing as well. So other inputs are coming from other ways as well. So I have 10 points to present. I won't get into too much detail because we don't have enough time here, but I think these are crucial to raise some points regarding on things that we need to discuss and need to make sure they are acknowledged in this strategy. One, it's the obvious that we need to institutionalize engagement across WHO processes. So it's about developing guidelines, protocols, but standards of this engagement and how to integrate in the outputs and deliverables of the WHO resolutions in the development of programs as well and technical guidance. When we talk about embedding engagement early and throughout the policy cycle, again, not bringing civil society when it's the time to implement something, but also bringing civil society when agendas are being set and when things are starting to being developed. Don't use this relationship with civil society for consultation. It's about building something together and co-creating. Engagement should happen in different levels with the WHO. So we can be engaged via wide consultations when we need more voices to participate in something that the WHO is doing, but also in expert consultations, advisory groups where the engagement will need another layer of engagement and feedback. With regards to strengthening inclusivity and representation, so again, what we've been talking a lot, how do we bring those unheard voices, they're hard to reach, underrepresented civil society groups? We'll hear in the panel today the importance of bringing grassroots and community-based organizations, because we know that in this, the relationship between the WHO and civil society is already very strong at the global levels. A bit more at the region, a bit less at the regional level, but when it's time to engage with grassroots, community-based organizations, it's more challenging. And with regards to formalizing co-creation mechanisms, we are talking, as I've mentioned before, going beyond consultation. We should be part of drafting work and also be part and be considered to join advisory groups. Next slide. A big point of concern is about transparency. We need to understand where we come in, what are the pathways of engagement, but also how our input and insights are being taken into account, and if they are not, if they are, and how, and keep us up to date with all of this. A lot is needed in regards to building capacity and building capacity of WHO on how to engage with civil society in all levels in different ways, but also building the capacity of civil society to be able to understand what is the WHO, what is this world of global policy, and what's the role and contributions of civil society. Point 8, we are talking about civil society, but we understand that we have registered and official organizations. We have advocacy groups. They are not registered, but they have a big role to play. A big example that keeps coming up all the time is with regards to youth groups. They are not necessarily an organization, but they have a big voice, and we all know the relevance of engaging them in global health. And again, establishing monitoring and accountability mechanisms. What is working, what is not, how we are mapping this, how we are tracking what good looks like, and so on, and how we learn and embed this in the engagement mechanism. And finally, number 10, sustain engagement beyond policy adoption. So what can be the other points of engagement with civil society? Can we, should we play a more active role in monitoring what the WHO is doing? Is this something that we should be doing based on the role of civil society to hold organizations accountable? But also thinking about feedback loops after this big events such as the World Health Assembly. What happened? What were the agreements? What we need to be shared and informed and with civil society for us to work together. And then there was a big effort from the previous working groups with regards to listing down the main or the guiding principles for this strategy. And this, we also discussed this in our working group, and we believe it's a very strong starting point. And it finishes, so we're talking about inclusivity. There are civil societies, not just one. There is a diversity of voices and expertise. We have to take this into account. Timeliness. I hope I got it right. It's about when to engage us in the processes, that we have to be there from the get-go. Transparency, of course, clarify processes and how also our feedback is being incorporated. Flexibility, again, there are different ways and touch points with civil society, and this needs to be taken into account. Co-creation, moving beyond consultation, accountability, understanding and measuring, and also understanding what needs to be adapted and improved. But I think it's very important to finalize with this last one. It's actionability, because this is an engagement strategy. We should aim high. We should expect a lot from this strategy, but we have to be clear about what is actionable, because we are living in a context that are putting a lot of challenges to the way we work, to the way that the WHO works, and this strategy should also take this into account. So I hope this gave you an overall, very high level overview of what has been done so far, and I hope this is useful for the discussions that we'll be holding from now on.
So thank you, Dani. So now we're going to switch over. We're going to have a panel discussion with some of those diverse voices, chaired by Milka Sokolovic from the European Public Health Alliance.
That's nice. To share with us, what do CSOs, what do the civil society organizations that work on the ground need from this engagement strategy? What should end up in the strategy such that it helps you and your work on the ground?
Thank you, Milka. Thank you very much for this opportunity. I come from Caregivers Asha Society, which is a grassroots organization itself, and happy to be part of CSO Commission. We all know that grassroots organizations are essential partners for the patient-centered care and universal health coverage, because without their participation, it is not possible to achieve that. Now, they bring the lived experience from the community. They show us what the society trusts and what are the local realities. And without having this information, any policy or any system developed won't work. But the problem is that the engagement of these organizations with the global organizations like WHO, etc., are fraught with certain challenges because the participant pathways are not very simple. We do not know, particularly as a grassroots organization, there are so much complex pathways for connecting, which are not easy for a grassroots organization to understand. Then besides this, they are not accessible to many of them. And the technical processes which are required to associate in these organizations are not feasible with those organizations itself, because they do not have that much system to develop those they say projects, or they do not have employed persons who could write grants, etc. So now with this, the communication also is difficult, particularly the technical language which is being used for these documents is not understood by many at this particular level. So now with this, we have insufficient linkages between the global organizations and the community-based organization. So what I feel, the task which has luckily given to us by WHO to suggest them the way outs. So what I feel that the pathways should be simple and predictable, and there should be some hand-holding or mentorship of the newer or grassroots organizations. The multilingual and accessible communication is needed, because many a times the language becomes a barrier. And in addition to this, as has been mentioned earlier also, that we have to have a strong regional and country level coordination and association, because for the grassroots organizations to reach to the headquarters is not possible. So they can connect at the country level only most of the time. In addition to this, what was mentioned by Danny also, that giving them the feedback of what input they had received. So giving them the feedback about the output of their contribution would encourage them to associate furthermore in this particular setup. And we need to include underrepresented groups, maybe elderly, caregivers, or poverty, or there are so many issues where we have underrepresentation of those organizations. So I think there is one important point which I like to emphasize, that the collaboration between these two organizations is many times decided by the size of the institution and the resources or the funds available with them. Probably that becomes a constraint for the grassroots organization to pass that particular step itself. So what I feel, that to have a meaningful collaboration for the grassroots organizations, we should have an engagement mechanism which is simpler, closer to the grassroots, continuous, because we do not want to have it at one time. An ongoing process would be useful, transparent, and easier to navigate. Thank you. Thank you very much.
Wonderful, thank you. I'm noting the key words for myself and also for all of us to keep in mind: simpler and closer, hand-holding and mentorship, accessible communication, and strong regional and country coordination. Thank you very much. I would like to take us now to a kind of CSO leadership level and ask you, Ravi, to tell us, to share with us the CSO Commission, the WHO CSO Commission experience. Where are the gaps that have been identified? What the engagement model between the WHO and civil society must include in order to be trusted and credible.
Thank you, Milka, and thanks everybody here in the room and online. It's very good to have this opportunity for all of us to come together in advance of the drafting of a civil society engagement strategy for WHO. Just a very few points, and then hopefully we'll have time for dialogue. Why does WHO want to have an engagement strategy? Or for that matter, why do they want to have a CSO, Civil Society Commission? And the simple answer is that WHO recognizes that the world has rapidly changed, not just last year, but even before, and that WHO has been left behind. And those of us in civil society know, and especially at the country level, if we want to talk to an international agency about health, we go to UNICEF, or we go to UNFPA, or we go to any of the other organizations that have a way to open their doors and listen to us and engage us in some way. At the country level, WHO is very closed, and WHO recognizes that. It's part of their culture, and the Director General is very open about this, and many of the senior staff recognize the need for change. WHO is highly siloed internally, and that's a problem that they have to sort out, but externally siloed away from the rest of the world. They know how to interact with ministries of health, but not with the rest of the world, including regular people. So what does that mean for the engagement strategy? Several of us do have interactions with technical offices in WHO, or maybe a regional office or a country office, but those are ad hoc. There's no systematic way of moving forward, and that's because of that cultural problem for the organization. There may be a few individuals, and they may reach out to those that they know and trust from other scientific meetings, but they don't know how to interact, for instance, as Arvind was talking about, with community groups. And let's be honest, on civil society side, we haven't gained the experience, especially at the community level or the national level, to interact with WHO as well, because those doors have been closed to us. So, number one is culture, and WHO is open to changing the culture. Number two is the systematic part. And from WHO's side, there's also, let's face it, not just lack of familiarity, but a sense of fear. Are we going to disrupt them? Are we going to show up burning flags and throwing rocks? Because they do see civil society, or some people worry that that's our approach. And I do think that's a legitimate approach for civil society. Let's not put it down. But most of us in civil society want to work constructively with WHO on a variety of matters. And we see that the technical guidance coming out is good to the extent that it works for our Ministry of Health. But how much does it trickle down to real people and communities? And that's not yet clear. So that's where WHO is coming from. It's the culture change and recognize the need to systematize what a few offices have done. I also want to speak from our side. And we have experience working with governments, working with other international agencies. We need to figure out what does it mean to work with WHO, right? And to do that in a systematic way. We also have to look at the power dynamics within civil society, because at the global level, and here's where we are in Geneva, many of us are funded to do this kind of work, or we've gained that kind of experience. But let's face it, if we go back, and I can say honestly, when I'm in Nairobi, I can email the country director. I cannot get a response. And therefore, I don't have experience in working with WHO at the country level. And that means when groups I work with want to sit down with the Ministry of Health and WHO as equal partners, there is still no way of doing so. And that's something that I think we as civil society can say, we want to build up that relationship, because it also helps us resolve some of the internal power dynamics that we face in civil society. So I know there's a lot for us to talk about. I think let's stop there, but let's keep in mind that the real drivers are WHO's need for changing its own internal culture, systematizing how it works with the rest of the world through civil society, and on our side, how are we going to gain the experience of bringing WHO to our tables and making sure that it's not just responding to what WHO has requested. And quite honestly, this commission is only not yet 3 years old. We're much better at responding to WHO's requests than the third aspect of putting civil society agendas on the table with WHO. And there's a lot that's happening this week. We're making strides. Those of you who are aware of the Here CSO Coalition, allied with our own commission, we're making some strides there, but we really see the bulk of the work happening at the regional and country level, and that's where we've got to make things happen. So number 3 for us is sorting out our own internal experience and putting our agendas forward. I'll pause there. Thanks, Milka.
Thank you, Ravi. You summarized it 3 times, so I don't have to. I will just take from here, the world has changed, so the culture must change as well, and that's what we are working on. And then over to the member state perspective with the experience of collaborating with the WHO and with civil society. So the question for you, Vesna, as you were the lead, Slovenia, and you yourself were one of the leads of the WHA resolution from 2024 on social participation. What are the lessons that came from that exercise? What do governments need from the civil society engagement mechanism?
I mean, I'm going to answer your question, but I'm going to say things I need to say. First of all, I have to thank you so much to invite me. I am working at the Ministry for Health now almost for 30 years. I have changed, I think, 28 ministers because they are changed really fast. I am a medical doctor. I was responsible for tough strategies like tobacco control, drugs, and these kind of strategies. So in the whole my career, I wouldn't succeed with anything if it was not, for me, always tend to work with civil society. Why is that? Because I'm old enough that I was already active in my former country, Yugoslavia, and that was a socialist country, and we had this organization of youth, and I was super active in those organizations, so I understood that even in that country it was possible to move things if youth got together. So I had this trust that if I involve youth, things will happen. And then I had to deal with HIV in my country in 90s, and I understood that we will never get to those groups if I don't include the NGOs that are on daily basis working with them. And I always repeat, we did not have epidemic of HIV in the group of intravenous drug users in Slovenia, while Italy had, neighboring country had 60% infected. So what does it tell you? It does work. So someone like that started to work with WHO right early in my career, and thinking always, why is it so difficult to understand that we are on the same side? Why governments and the ministers hesitate to involve civil society better? And actually, I think the reason is also in civil society, because you tend to turn most of the time to political level of the government, not to technical people as I am, that am there for ages, and that I'm responsible also for funds, you know, at the Ministry of Health and my colleagues, of course, you know, and that deal with institutions like public health, because we are in charge even of those, you know. So it's not always clever to bypass those people and just go straight to the minister and then feel super well because the minister is nodding at the meeting, but next meeting industry comes, he's nodding too. So you see, that is not how it really works in reality. So when I was at the EB and had this opportunity to become a chair of EB, I had only one priority, which was my country's and my personal priority, to try to get the countries on board to do something better with civil society. And the result of this is social participation resolution. And as you can see, I'm everywhere, and my colleagues from Thailand, Brazil, and so on, they are everywhere to ensure implementation. It was super tough with this prioritization process because they wanted to, you know, people that worked in Euro region, I'm from Euro region, and at the headquarters, they said, well, not really priority, let's, you know, forget about it for some time. But us countries that are involved in this, we didn't let it. So we are strengthening capacities rather than, you know, giving up with this strategy. Why is that? Exactly what it has been said. The world is changing. The governments are super vulnerable. Ministry of Health, it's like ministers are most of the time super weak in their countries. Sometimes some ministers are strong, but that is, it's just a coincidence. It's not happening really. But the value health in the society is super strong in most of the societies, you know. So a social participation resolution is, I have seen an opportunity. And I share with you that, for example, and that is important to understand how it works. China, you know, China is somebody from China here? China? China, your government has problem with civil society because they understand. But I'm allowed to say everything, so. You don't say anything, it doesn't matter, but I know this, and it's my country as well. With some parts of civil society, my government has problem because they are opposing, and that's okay, that's okay. But in health sector, there is another way of working with civil society. So one thing is advocacy, and you know, and that is completely fine, but the other way is working together, and we call it now social participation. And when I addressed this with delegation of China, I asked them, because, you know, we had similar history in a way, you know, and I asked them, I said, don't you have organizations of youth in the communities, organizations of people, patients, pensioners, and they said, yes. And I said, you see, social participation is when civil society, the government, but also professionals share the values and the goals. Otherwise, we don't speak of social participation. We speak of advocacy, whatever. We speak of something else. And they spent 1 week, and your delegation came back to me and they said, we support. So your delegation supported a resolution on social participation, because this is what it means, social participation. And let's start here, you know. But for this to happen, you are right. We have first to educate WHO, people in WHO. It's essential. There are some departments, and I had a very good experience with the Department on Reproductive Health, that understand that they can do nothing if they don't involve civil society. They understand. But there are many departments that deal with health system, this and that, preparedness, I don't know what, that still don't understand it really well. So this resolution now is a very good opportunity to discuss with them and make them understand that there is a superpower that can support governments, you know, not the whole government always, but the ministries of health. That's also another thing, you know. If we discuss tobacco policy, alcohol policy, you know, it's a Minister of Finance and Minister of Health, and they are not on the same line most of the time. So we are supporting Minister of Health and people working with Ministers of Health like me, you know, and we can support WHO that is supporting Ministers of Health to do the right thing. You know, so this strategy actually should release those hesitations that FANSA has brought in, this insecurity of WHO, let's call it insecurity, you know, that something might go wrong if they work too too much with you. So yeah, let's put criteria. In my country, we work hand in hand with civil society. We finance civil society from the budget. We have 3-year standards. We pay civil society that works with the government. It took us some time, but this is going on now for 20 years. We would want to evaluate the impact of this kind of collaboration, the impact of what civil society in certain area does. Why? Because we want to convince the government, the Minister of Finance, that it's worth investing money by the government in civil society. And we want WHO to work with us countries on this. And there they will learn, because if we can prove that this kind of collaboration brings us faster to the results, to everything we preach here, then there will be appetite for more of such collaboration. So we have to evaluate, blah, blah, blah. I'm finishing here, and I'm really happy that we have this discussion now, and will be very happy to involve me from your side to contribute to the strategy. Thank you very much.
Wonderful. That's exactly what you needed, what we needed you for here, Vesna. So Ravi has opened the worm can of hesitation and insecurity and the siloed position of the WHO, and Vesna has presented the solutions in the form of triangulation between government, civil society, and professionals, sharing the values, working towards the same goal. And what I found really clear and impactful, Vesna, is the idea of setting the criteria for collaboration, investing into the work of civil society, and evaluating the impact of their work, because then you can move to the next step, adjust, improve, and then move on. Wonderful. I would still, if John allows, John and Daniel allow, that I would still open space for some questions. Is that possible? Short, 5 minutes. 3, 4 hands. Okay, please, here in the third row. You please, glass. Microphone. I don't mind, but you have a line. Yeah, just there. It's coming in a second. Please introduce yourself.
Hi, my name is Amanda Bach. Many of you know me. Arvind, you don't know me yet. Everybody else on the panel knows me. I work for the Synergist. I also lead the patient movement catalyst that many of you are involved in. I have a 3-pronged question. Of course, you guys know I empathize and relate deeply to everything you've said. I think you're very much preaching to the choir here. My 3-pronged question is, if we look at commentaries such as those that Ilona Kickbush published coming into this assembly, that it's not about architecture as such, it's about the power. And if we look at that and we talk about social participation, it reminds me of comments that a fellow PMC steward yesterday said for Asia Pacific. It's about safety. You only have social participation in places that have safety. And I love your comments, Vesna, about that part of civil society helping the Minister of Health, and how we can circumvent the advocacy and the activism charged conversation in those areas. To which extent will you be therefore advocating internally for the WHO to learn from other agencies that have been able to do it, possibly because they're prevention-based rather than acute epidemic emergency structured, the way the WHO has been to some extent? The UNICEF, the UNFP, WFP, it's at World Food Program, WFP, etc., and a lot of the actors in the humanitarian and the development space work with civil society in an implementing partner arrangement, largely to your point about social participation and needing that superpower, because it's about prevention and it's long-term planning and it's strategic and it's operating partners on the ground. To which extent can you influence the WHO also changing its culture, the way we all need to change our health system cultures, moving away from acute towards preventive, personalized care, centralized care, with the 70% NCDs that are growing nowadays? So that's my 3-pronged question, very messy in my head. I hope it's landed a little bit eloquently, and I let you guys react. Thank you.
I would like to take a couple more questions on top of the 3-pronged one. Over there in the last row.
Dr. Humphrey Monde from Zambia. I represent an organization called Civil Society Health Partnership. which is a lead umbrella organization in health. My question or concerns goes to our panelists there in relation to WHO Commission and also in relation to civil society collaboration or partnership. What I'm seeing, there's something lacking under our strategy. This, I'll be very, very open with you. If you go down to our countries where we come from, or let me be specific about Zambia, it's more about the Ministry of Health and the partners. The civil society are left out. When there are critical issues, that's when now government and other partners would come in and say, let's involve civil society. But the way I believe is that we're supposed to have some form of a tripartite arrangement where we have the government, cooperating partners, and civil society, because we are the voice of the patients out there. But in most instances, CSOs are not, there's nothing we may talk about. You only recognize when there's a challenge in the country. So I believe that as we are developing our strategy, let's be proactive and justify that CSOs play a very key role in ensuring that all these other issues are adhered to. So I look forward to, from the Commission side and all the panelists here, where we are going to have formal representation also from the CSOs at grassroots level. I know at the national level we have umbrella organizations, which will be very easy for you as Commission to work with umbrella entities at the national level, be it also at the regional level. I thank you. I submit.
Thank you very much. There are two more hands there. Short questions. Yes, lady there, and then Houston.
Hi, thank you for having this panel. My name is Elisha Dungiorgio. I'm with Global Health Council based in the United States. We are part of the commission. We're also a non-state actor in official relations. And I wanted to ask Dr. Petrich, you mentioned WHO's insecurity about civil society. And I think speaking as a non-state actor in official relations, like that's a palpable feeling. You know, we have FENSA, and I'm just curious to hear from you if you think there's a possibility that member states could come together to revise FENSA to make, because the WHO Commission is great. It's good to have more voices. It allows more diversity, but the civil society power sits with those of us in non-state actor and official relations. This commission can consult. It can act in many ways as a free labor arm of WHO, which, I mean, the amount of the labor that's gone into this commission from all of the civil society members, unpaid, hours and hours, I know because we've participated, is not the same as an equitable relationship between civil society, whereas Ravi brought this up, civil society is able to engage with WHO and raise civil society's concerns. It is very much right now a unidirectional relationship where WHO engages with civil society to expand its reach on WHO priorities. With FENSA status and non-state actor status, you are able to make statements, to influence the process, to be in negotiations, to talk with ministers, to talk with civil servants. It's a very different setup. And so ultimately, the inclusion of civil society in a more equitable fashion requires FENSA to be amended.
Thank you very much. And then just Justin, and we're finished.
Hi, Justin Coonan. I'm a member of the Civil Society Commission Steering Committee with a slightly croaky voice and a recent co-chair of WHA 2030, the Partnership for Universal Health Coverage. So I've been a member of the steering committee for the last 3 years alongside Ravi, alongside John, Milka, you're there at the beginning. And everything I say from here is meant with the utmost fondness for everyone within the Commission and also within WHO. I have many very close colleagues. 3 years ago, when we first met, nearly 3 years ago, we spoke about the fact that we were going to shape WHO civil society strategy. 3 years later, we're still talking about, okay, we're going to shape a WHO civil society strategy. So, and notwithstanding, of course, the world has turned upside down in that time. I acknowledge that, and of course, the important progress that we've made through the social participation resolution and other matters. But I guess my question for reflection for all of us, again, without criticism, is why is this so hard and why is it taking so long? Is it that just things have just got really difficult because of what's happened to WHO? Is it because of the institutional resistance that Vesna and others have talked about? Is it a technical problem? Is it a values problem? But the reality is that we're still talking about the thing that we were talking about 3 years ago, and I just would like to know why. And I take full responsibility as a member of the steering committee for my part in that.
How about one question each? You pick the one that you find the most challenging.
Last word.
Okay. Okay. I mean, it does not make sense to answer one question. I'll try to respond to all three of them. Honestly, I'll first talk to my colleague from Zambia, whom I think I know for some time already. The wrong perception is that resolutions are meant to tell WHO what they should be doing. Yes, definitely. But resolutions are also an agreement of countries, what we are going to do in our countries, each of our countries. And in social participation resolution, we are actually asking countries to, in a way, it's not really, the word was almost prohibited, but doesn't matter. It says anyway to institutionalize social participation and WHO to help us with this. And this is exactly the answer to you, because we first have to recognize the power, but some of us, many countries already do, and then to make sure that there is a continuum, as you said yourself, of collaboration between the people, ministries, public health institutes, and the civil society when addressing a certain problem that a country has. That is what is social participation resolution for. So it's not just meant for WHO. Moving from prevention, from curative to preventive, it depends which country you are at. In my country, for example, we have super strong civil society of youth participation. In my country is the strongest. They are the ones demanding better health policies. But if you only have patient association, you have to work with those to make them understand, yes, you have all the right to ensure that the treatments are more fit to what you need and available and so on. But there is also maybe additional task to ensure that other people will not be affected. And there are other organizations that we use. We use associations of different sports to work with us, the scouts, we use the scouts to work with, we really engage, firefighters, they are contributing a lot. They have been really active in colon cancer screenings because men didn't attend. So through firefighters, we got men on board. There are so many opportunities, but you have to expand. It's not just those that are already active and with all the right, I also say. So I'm not saying no, I'm saying yes. So these are the things. And your question was also interesting, but I a little bit forgot. The FANSA, FANSA, this is my headache. FANSA is my headache. And when we are going to change it, why would we go on another process? Let's make this strategy right first. Let's come out of these strategies that there is a need to change FANSA, then get totally exhausted because the process of FANSA was, super long, and it didn't bring us far because there are so many stakeholders who wanted to make sure, and even the countries, that nothing will go wrong with these difficult the NGOs. But I'm simplifying it, but still, so I would suggest strategy first, And from the strategy, it would appear very clear what needs to be changed in FENSA. That would be my recommendation, you know. And then, even more important, the local level. Yes, they are stuck, but not everywhere. For example, in Slovenia, we have the office, because the government, us in the government, demands them involving also civil society. Why? Because we trust our civil society. They are released of these, you know, constrictions, and they also work with us to train civil society and do the job. Nobody is preventing this, actually, when the government is for. So, yeah.
Thank you, Vesna. So, yeah.
I think
institutionalize, think out of the box, strategy first, and then FENSA whenever. Arvind.
I think I will just last sentence that listen to the grassroots CSOs, because they are the hearing apparatus of the organization, of the health system. They are the hearing apparatus, and we have to listen to them. And please make the strategy so simple for them to navigate. That's it. Thank you.
I'll try to be quick because I know we want to have more discussions as well. Humphrey, very good to see you in person. You've been so active online. And so I'm looking to you to help us move ahead because we need people like you. Very simply, actually, let me back up. Let's give WHO credit because it's easy to criticize them. And just 5 years ago, WHO's experience with civil society was the ad hoc, some technical unit reaching out to those people that had met at a health research conference. And that's who they invited. And that was the pattern for WHO. Where we are now, this is hosted by UHC 2030. WHO maintained control of the agenda. They said, this is UHC, we're working to support SDG 3. But they lost control of who's involved. They let go of the membership. And that was a huge step by WHO. So let's give them credit there. Now with this commission and the upcoming strategy, as delayed as it is, they're willing to let go of the agenda. And that's a huge step. Far behind Gavi, far behind the Global Fund, but nevertheless, for the Global Health Authority that WHO is, these are major steps. So let's recognize that they are taking risks. And it gets to what Cessna is talking about. We have, we're working with WHO to build trust, because the more we have trust between civil society and WHO, then we can get to Humphrey's point, where WHO inviting civil society to a meeting with the Ministry of Health builds trust between our governments and communities. And that's something that we struggle with. I can say even in Kenya, there's one network that the Ministry of Health will turn to because they want to check the box that they talk to civil society, and they know that that group is willing to work with the Ministry of Health and not to hold the government accountable. And so there's a lot more that we have to do. So that's just a piece. Just quick other answers, Amanda, I hope I've touched on your points in answering Humphrey as well. But Elisha, I very much agree. If we get the strategy moving ahead, we get the experience to see what do we want to do with FENSA. But I don't see that politically this is the right time to reopen FENSA because I think it'll go backwards. When we would find that moment is hard to say, but I think this is not it. And Justin, if we in civil society took the pen away from WHO, we would have a strategy. It would not be owned by WHO. I can't answer why they had promised that they would involve us. Now we are moving ahead, and that's the working group that Danny and John are leading. Hopefully this will catalyze more within WHO so that they can actually take some of our ideas, put together the draft, bring in their legal department, and we get some form of a strategy by the end of this year. I think for us, let's keep in mind that there's a transition within WHO. Starting from the executive board meeting in January through next August, there'll be concrete steps as the current Director General, Dr. Tedros, hands over to his successor. And we want the strategy in place and working by next year's World Health Assembly. So that's a call for us to put pressure on WHO, take the material that the working group is producing and put it into some form of a strategy, which can be a living document. We don't have to get it right the first time. That's it for now.
Please, a big round of applause for our wonderful panelists. Thank you very much for your thoughts and your courage and your good work. We won't stop here. We take it from there. And now I give the word back to the co-chairs of the working group.
So, fingers to your phones. We're going back to get some of your input on the Mentimeter. Just incorporates. Okay. Danny earlier said that there's been previous work on analyzing WHO's engagement with civil society, identifying a number of principles, but that list might not be complete. This is your opportunity to add to the list, but also maybe to prioritize it, indicate the ones that are most important from your perspective. I can't show the list again. If we can read out the list again. So yeah, just to repeat, those headline principles identified were inclusivity, timeliness, transparency, flexibility, co-creation, accountability, and actionability. But as I said, it may be that we've missed something there. So. Okay, so accountability is right up there as the top of the list, followed by transparency and co-creation, actionability, disability, inclusivity in other forms as well. Okay, thank you. Let's go to the next question. You're gonna have to type a little bit more this time. We're gonna ask 3 questions now about. The first one is expectations. What should WHO engagement deliver? So it's not just the question of we want to engage for engagement's sake itself. What should be the output of it? What are we looking at as a concrete result? And here you can type in. This is not a word cloud. This is just we'll be picking up your suggestions, and you can vote for other people's suggestions as well if you want. Measurable outcomes, co-created policy, meaningful engagement. It might actually be easier. No, it's okay. It's just they pop up to the top, then we don't see them as well. And this is going, this is all going to help us in our work over the next couple of months in going back and forth with the Secretariat, and hopefully you'll see these principles getting reflected in the document that comes out for consultation in September. Okay, the next question is lessons from the past. What should WHO do better? I guess, our expectations of WHO. Also got lots of comments coming in. Decentralize, talk to people and not at people. Genuine collaboration. Making things simple, coming back to Arvin's point. So, and the third question is outlook. What must guide future WHO CSO engagement going forward? Maybe we're coming back to the principles, maybe there's something else. Again, this exercise is about helping us to make sure that we're not overlooking things, so don't feel constrained in what you suggest. If you think that things are on the right track, maybe say that as well, but otherwise feel free to add considerations that we should be taking into account. Lived experience. Community, inclusivity, community again. Great, thank you. And now we're going to invite 3 of our members of our working group to synthesize the findings of today's discussions. The first is Wafa Al-Madagi, who is online, the co-chair of the Civil Society Commission, along with Ravi Ram. Second is Fiona Lawless from Sightsavers. Do you want to come up to here? And third is Simang Lee, who will give us a youth perspective. Wafa, are you able to take the floor?
You can hear it?
We can hear you faintly.
Okay, I hope.
I think you're on mute, are you?
Oh, okay. I just want to give back from today. First of all, I think there is very fantastic interventions in the room, and also there is a lot of questions that has been raised from the onlines, and it's already been addressed, and there is the things that they want to know, what is related to the real engagement of the strategy, and how they will be the efforts and the policy that will be needed during the regional and country levels, what kind of training or activities that will be engaged. The things that we want to know that this is we are giving the recommendation to the WHO so that we are making effort. And today meeting, for example, we will get also from the discussion and the different recommendation that will be built when we go back to the working group. Also from the onlines, there is a process, they are asking about also the engagements of the CSOs in the, let me see the question, that is related to the global health agriculture reforms and the representation there. And already that has been addressed, that there will be engagements, but to be actually, there is no positions in the task force. And also from many meters, you see the question that all 4 that they are focusing about transparency, participations, clear voice, Last things I want also to address that how they are actively participating or which platform that their voice could be heard. First of all, there is, for example, in LinkedIn and there's a social media that is you could go there and you see could also be actively participated when they are posting. There is also events, consultations that mostly has been sent through WHO, so that if you are a commission member, so surely you will get these emails. So we encourage that every time that's every commissions to be engaged, so that will be their voice here. This is what I just want to add as a all from the online feedback. Thank you.
Thank you very much, Wafa. And Fiona.
Thanks. I think I'm going to pull out some things that seem to come across all of the questions in the word cloud and in the Mentimeter. There is a lot of things around wanting less siloing of WHO, but also less siloing within WHO. So a lot of talk about how there can be more accountability and engagement both to civil society but also within WHO itself, and how there needs to be increased national engagement and CSO empowerment, which I think is something that is coming across very strongly, both in terms of the discussions we've already been having as part of this engagement strategy, but also from what's been said on the Mentimeter. There's also a talk about, it came across really strongly, about genuine engagement, so a move from kind of tokenistic consultation or tick the box consultation to co-creation and talking to the people instead of at the people. And that came across in a number of different ways around kind of genuine collaboration, empowerment, building that trust, which obviously comes from when civil society feel like that their voices are being heard, whether that's at the national level or at the global level. And then obviously the equity and inclusion part comes across really, really strongly a number of times.
And Simang.
Perfect, thank you. I think as to bring the youth voice to this last part of the discussion, I think it's good to recognize that for WHO engaging with civil society, they're really trying to engage with youth. We have the WHO Youth Council, and also in the Civil Society Commission, we also now have a youth chapter. So that engagement is there, and those formal networks are a good start to continue engaging youth. However, one thing that I also really heard from the panelists, and that I, from a youth perspective, also resonate with, is that it is hard to actually get the grassroots level included in those formal networks. It is professional organizations that are on these formal groups of youth engagement in WHO, and even more so for young people, it is harder to make their voice heard. And I do think that those local perspectives is where the real impact is. So in that sense, that is one thing that both we as Civil Society Commission can do, that WHO can do, but that I would also like to ask on all people here to take into account in their work, to focus on local perspective, the grassroots voice, and especially also include young people in your work there. Because we don't have to wait for this strategy for WHO to start doing it. I think what WHO also needs is our help. And a lot of our organizations are very experienced in working with the grassroots level, young people, other underrepresented groups. And I think if we can continue to do that and present some best practices to WHO for when they have this strategy in September, I think that would be a really, really good start.
Thank you so much, C. And on behalf of, well done. I really had high hopes with regards to these discussions, but it went beyond my expectations, because having history about things that have been tried, have been attempted, sometimes went well or not so well, Dr. Petra mentioned, but also taking into consideration what is happening at the ground level, and because in the end that's where we experience health, ended up bringing so diverse and important perspectives to the work of the working group. If you don't mind, yes. So a big thank you for this. It was a bit more rushed than we expected with regards to the part of the Mentimeter. We were expecting to have a little bit of discussions, but the panel and I think the questions asked afterwards, they were so important that we didn't want to stop this from happening. Next steps, what's happening? We are not the ones who are drafting the strategy, but this will all be shared with the WHO Secretariat. Kaiser, that you heard, he's the one developing this. We'll have drafts and discuss these drafts throughout July and August, and hopefully in September we'll have a final draft to be shared for open consultation, and that's where you can help us a lot, because of course reply to the consultation, but then share within your networks. If you hear about any challenges from different organizations that you work with, bring it to us. Maybe we'll have to adapt something, and this whole process need to be done in a way that we are careful with those who are part of the consultation, to understand the challenges of understanding the language, understanding what's in the strategy, and then feeding it back into another version of the draft. So I think we now, unfortunately, really need to stop. But Dr. Petra raised your...
No, I just want to, sorry, I think everybody hears me. I just want to ask, are we aware that countries will be included, so ministries will be included? So it's really important that we start working with your ministries. You should start working with your ministries this way or the other. You can do it even through health professionals. You know, you obviously do work with health professionals to say and to explain what social participation is, and ensure that the governments then will not scrutinize this strategy and understand it wrongly. So I think it's best to start doing this as soon as possible. It's not all the governments that are aware, I think, even of this, and not all the governments will have the same understanding.
Very relevant point. Thank you so much for coming and joining us, and let's keep in touch. And if you haven't joined yet the WHO Civil Society Commission, please apply. We need more voices. We need more input.
Let's take a picture.
Let's take a picture. Yeah.